Physician-assisted suicide, also known as euthanasia or physician-assisted death, is defined as the voluntary termination of one's own life by administration of a lethal substance with the direct or indirect assistance of a physician. This is done in cases of terminal illness with no viable treatment or cure and is highly controversial. Euthanasia goes as far back as the Hippocratic Oath in the 4th century BC. Initially, people were opposed to it, and in 1828, the first official U.S. statute outlawing it was enacted. As the 19th century went on, people began to accept it, but at the beginning of the 20th century, attempts at legalization were defeated. In the 1930s, support for PAS increased during the Depression. A number of coalitions and leagues in favor of it came to fruition. However, Nazi use of euthanasia in World War II quickly changed the American public's positive view of PAS, and support for it continued to decline throughout the mid-20th century. The tainting of euthanasia by the Nazis faded as we approached the end of the 20th century. More societies and leagues appeared, and in '76, California signed into law the Natural Death Act, which allowed terminally ill individuals to remove their own life-supporting treatment if death was inevitable. California set a precedent. Just 1 year later, several U.S. states had enacted some sort of right to die. This included California, New Mexico, Arkansas, Nevada, Oregon, North Carolina, and Texas. From here, support continued to flourish, but religious groups, including the Pope, were still outspoken against euthanasia. By 1990, a public survey showed that over half of Americans were in support of physician-assisted suicide. In this same year, the well-known Dr. Kevorkian participated in his first of many physician-assisted deaths, that of Janet Adkins, who suffered from Alzheimer's disease. In 1994, Oregon passed the Death with Dignity Act, becoming the first state to officially legalize physician-assisted suicide. Not everyone agreed. This caused President Clinton to prohibit use of federal funds for PAS, and the Supreme Court to rule that dying is not a right. At the beginning of the 21st century, the Netherlands legalized PAS. Meanwhile, people in the U.S. were still challenging Oregon's laws and speaking out. However, in 2005, the Supreme Court repeatedly refused to intervene in the famous Terri Schiavo case, showing possible support for a right to die. Her death brought much attention to this issue. The Supreme Court continued to show support then. In 2008, Washington and Montana legalized PAS, followed by Vermont in 2013. From then to the present, instances of PAS being allowed or being made legal have been seen in many places, including New Mexico, South Africa, Colorado, New Jersey, and New Zealand. One main benefit of physician-assisted suicide, cited by its supporters, is that it gives terminal patients the right to die with dignity and control. A second major argument is that medicine was created to relieve patient suffering, and that physician-assisted suicide falls under this duty. From a legal perspective, some feel that disallowing the right to die goes against the American value of liberty. Bodily autonomy and integrity are generally applied to areas such as medication, reproductive rights, and contraception, and the right to die should be no different. Freedom should be respected in this aspect the same as it is in the others. There are also some cons. Some people feel that the allowance of physician-assisted suicide will cause terminal patients to be rushed into making a decision, or feel pressured to choose suicide in order to relieve medical providers or family members of the burden of having to take care of them. Another perceived con of physician-assisted suicide is difficulty in determining when patients are, quote, terminal. Some people believe that there is a blurred line between what is terminal and what is not. Should people with challenging disabilities be considered terminal? What about debilitating mental health issues? Who would determine this? Physicians themselves have mixed views on the subject. Many physicians are against it as they feel it goes against the Hippocratic Oath of do no harm. They believe that compassion and care is what is needed at the end of life rather than assistance with death. Some are also concerned about, quote, playing God and making decisions they feel are not theirs to make. Many physicians are in support of euthanasia. Some believe that assisting with death in terminal situations is being compassionate and caring and that they are helping their patients. Further in this vein, many believe that relieving suffering is a core of medicine and that physicians must do everything in their power to relieve pain, including PAS. Is PAS constitutional? The Supreme Court has shown instances of both supporting and disallowing PAS. Many believe that the right to die is as constitutional as any other American freedom. However, others believe that it may not be so much a question of constitutionality as it is a question of adequate end-stage palliative care. There are many stories of PAS. One disturbing example entails an elderly, dementia-ridden Oregon woman whose daughter appeared to, quote, shop for a doctor who would deem her demented mother fit to choose PAS. One finally approved her even though she was clearly demented and the daughter was said to be coercive. This could happen in many situations. There are also many disturbing stories in which PAS may have been right. One woman had a horrible experience of watching her terminal father starve himself just to have control over how he died. Another man described the difficulty of watching his mother become debilitated beyond functionality. She wanted to pass but was forced to, quote, suffer to her last. Many people have strong opinions for or against PAS. However, it appears as though over the centuries, the US and other countries have shifted mostly in favor, with many laws having been created and new ones coming about frequently. This may be due to a rise in individualism and people demanding their rights. If the past is any indication of the future, then it's reasonable to assume that the legalization of PAS may become more widespread. However, whether or not it is accepted by everyone, the practice of PAS is a complex issue that requires careful consideration of all factors. At the end of the day, a physician's goal is to do no harm.